Hello and welcome to the Rogue Dermatologist. Today I'm going to talk about a very important subject, vulvitis. Well, what is vulvitis? Vulvitis is irritation of the female private parts or the vulva. What is that? What is irritation? Well, irritation is when the skin gets rubbed the wrong way, no pun intended. The skin becomes irritated or very angry or upset, and that can look like redness, itch, burning, pain, maybe even painful cuts on the area, discharge, which can sometimes smell, and those are features of irritated skin. Now, irritated skin or an irritated vulva can have many different causes. Now, what are some of those causes? The first and foremost cause of vulvitis is physical and chemical irritation. Those can be a result of the secretions from the area, an application of the wrong product, which can really work up the skin or the mucosal surface, and tight underwear or other types of friction related to sexual activity and other activities related to the area, such as wiping, washing, scrubbing, cleaning, any one of the abrasive practices that we've talked about in the past. All of those can lead to vulvitis. Additional causes of vulvitis can be application of topical medications or topical skincare products that can have ingredients that can induce either chemical irritation or an allergic response over the area that again can lead to the same appearance, that redness, itch, burning, pain, painful cuts that can appear over the area. There are other causes to vulvitis, and those include infectious organisms colonizing the area, such as bacteria, fungi, viruses can actually infect the area and can lead to vulvitis as well. And there are things that can look like vulvitis but are not vulvitis. These are the copycats of vulvitis. Copycats of vulvitis include skin cancer, and there are certain types of skin cancer that can look a lot like vulvitis, specifically squamous cell carcinoma and Paget's disease. These can all look like vulvitis but are not vulvitis, and they need to be diagnosed and discerned or distinguished from vulvitis. So, what can be done about vulvitis? Well, very interestingly, the first thing to do is do no harm. What does that mean? You want to back away from anything that could be potentially irritating the skin or the mucosal surface. That means avoid hot water above 104 degrees Fahrenheit or 40 degrees centigrade. Avoid detergents over the area, specifically soaps, cleansers, body washes, shampoos of any kind, unless you were specifically instructed and agreed to use a product over the area for a specific treatment of a condition you may have. Other things to avoid are physical abrasives, and I know this is becoming very popular to abrade the area, scrub the area, exfoliate, do all sorts of crazy things to the area that serve no purpose whatsoever but can really get the area worked up and become very, very irritated. Avoid all these practices as a baseline rule. Do not engage in those practices, as those can really irritate the area big time. The other thing to remember is do not blindly disinfect the area. Disinfection of the area with things like alcohol, hydrogen peroxide, or other disinfectants can really work up the area to a frenzy. That is an automatic response for a lot of people sensing there's something wrong with their skin, and the vulva is no exception. There's a trigger or a knee-jerk reaction to go and try and disinfect the area, get rid of whatever is going on there, but that can often backfire and can lead to growing irritation, to more irritation, more grumpiness of the local skin or the mucosa, and that can lead to your troubles getting worse. Another thing to avoid is automatically treating the vulvitis with the first thing you find in your medicine cabinet. A lot of women I've counseled at my practice reached out to the first thing in their medicine cabinet to treat irritation over the area. Specifically, very popular products to be used over the area automatically are antifungals and antibacterials topically. Now, those products, while they may seem innocuous and you're probably thinking, what is the harm in using these medications? Many of these topical medications can actually irritate the skin, especially if you're treating the wrong condition. If you don't have fungal or yeast-induced vulvitis, or you don't have bacterial-induced vulvitis, you may actually make your condition worse. And even if you do have fungi overpopulating the area, or bacteria overgrowing or infecting the area, your antifungal or antibacterials that you have at hand may not be the perfect fit and may cause irritation over the area again. So what should you do? Well, seek advice from the best. see a board-certified dermatologist and consult them about what is happening, whether the vulvitis is an irritant vulvitis, meaning it is caused by a chemical or a physical irritant, whether the vulvitis is being caused by an allergen that is applied topically to the area consistently, inciting a response over the area that could be causing vulvitis, whether the vulvitis is caused by fungal or yeast overgrowth or infection of the area, whether it's caused by bacteria overgrowing, possibly even infecting the area, or it's caused by a viral infection of the area, specifically herpes simplex virus infection of the area. Those are all possible causes to your vulvitis. So those all need to be distinguished and treated specifically to, first of all, get rid of the inciting cause, and second, treat whatever is left, whatever residual inflammation there is, to make sure things go back to normal and you can resume your normal life. Also, it's important to remember, there are things outside of your list of possible case scenarios that could be causing your symptoms. So those need to be distinguished as well. If you have persistent irritation of the area despite treatment of what might seem to be the cause, things need to be distinguished further and diagnosed with additional tests, possibly a culture, possibly even a skin biopsy of the area, to make sure that you have everything bottom line and that you know exactly what it is that you're treating. Very importantly, once you see your dermatologist, determine what it is that you're treating, determine what it is that you're going to use to treat the area, determine the time frame and expectations. How quickly is it going to take to turn things around convincingly and significantly? And when should you expect things to go back to normal or near normal so you can actually resume living your life without having to worry about irritation over the area? If things don't turn around within the expected time frame and don't look convincingly or significantly better, things need to be obviously diagnosed further, and more questions need to be answered as far as what's causing the irritation and why is the treatment not working. If you've benefited from this video, share, like, and subscribe. Let people know about this channel. I hope you derive much benefit from this video. Thank you so much for watching, and God bless.